really think that a successful implant is actually an implant that doesn't change at all over the course of 10 to 20 years. You know, if there's a little bit of change, that's great, but I would say a really successful result actually is an implant that hasn't changed and the bone levels around the implant stay really healthy. Gone are the days where we get this thing called cupping, where you see a big dip in the bone. And, we're now at that phase of dentistry where it's like, we really shouldn't have that. Okay, so that's what I think. That's what the modern literature says. Read Zero Bone Loss Concepts. It's all there. People think that implants are only for cosmetics, but, at the end of the day, most of the implants that I place are actually in the back, right? They're all in the back teeth. And the reason that we place a lot more implants in those back areas and why it's so important is actually for chewing, right? We have to live our life. We have to eat. And if you're not able to eat or chew properly, like your quality of life goes down, right? And so, functionality speaking wise, implants are actually a great way to regain your bite ability and regain your ability to chew again. Here at Pac Dental, we use a CBCT machine. So it's essentially a CT scanner, but literally just for your head and neck. And so the reason why we utilize this technology and why I've actually invested heavily in that technology is because, the new standard of care is knowing exactly where your jawbone is and then knowing where your nerve is in relation to the jawbone, right? If we don't know where those things are, the chances of me placing your implant successfully are not as high as they should be, right? Have they placed many implants without it? Sure. But would I place an implant on my mom without a CBCT scan? No. The reason I also use that CBCT scanner is actually I do what's called digitally guided implant placement. What that means is that I'm doing your surgery before I even do the surgery. I know exactly the angle, the size, the depth of that implant before I even touch your mouth. And so that's why we use the CBCT, and that is the new standard of care. There is a difference between implants and bridges. And so the fundamental difference that you'll find between the two is that with an implant, it's a one tooth fix. That it's a one tooth problem with a one tooth fix, right? And so essentially we're only going to be replacing the tooth that is broken and infected, and that's it. Now, if we were to do a bridge, chances are if your teeth around that spot are healthy, now we have to drill those teeth and we have to use those to hold that fake tooth in the middle, right? And so, the big difference is that now we have to use your healthy teeth to give you a fake tooth. There is also another difference in that most dental bridges, their prognosis over the course of 10 years is not great. Some studies show that the prognosis of a dental bridge is 50% within 10 years, which is awful. That means 50% of those bridges fail. Given that my patients don't. And the only reason why, maybe my patients don't have as many bridges fail is because I actually prepare them. I tell them, hey, you need to use a water pick. You need to clean this thing every single day if you're going to do a bridge. If you're not, you still need to clean it every single day if you're going to get an implant. So either way, you got to clean it. You just have to choose what you want to do. Oftentimes, my patients will ask me, do I need to do this bone graft, Dr. Pack? I just want to get this tooth pulled, and then we'll think about the implant later. And what I have to say to that is that, yes, theoretically, you can have that tooth pulled, and theoretically, your jawbone isn't going to change. But the chances are that you're going to get some bone loss in that area. You're going to lose some jawbone. And if you don't put a bone graft in that spot, what's going to happen is your chances of having a great site for an implant 6 months to a year down the road are not going to be as good as if you did do a bone graft on that same day that you took the tooth out. If you were to have done the bone graft, your chances of doing an implant right away is a lot better. Now, if you didn't do the bone graft, what's going to happen is that there is a big chance that you got bone loss. And now when we're putting your implant in, we have to do a bone graft there anyways. And so it's like, we're really trying to not have to do that at that time. Doing the bone graft at the day of tooth removal is way more predictable than doing a bone graft on the day that we place the implant. Right after the surgery, a lot of my patients find that actually they have some very minor soreness after the surgery. It's not a whole ton of pain like they had prepared for and they thought of. Unfortunately, in the world that we live in with social media and all kinds of stuff and information access to information, all we hear are the horror stories, and we never hear about the 99% of great stories where people had no problems, no pain, the implant went in easy, and they still have their implant 20 years later.